Hey, this is Dr. Tonya. I'm a board certified oncologist and breast cancer survivor. I'm here to give you the hope, information, and inspiration you need to make your next season your best season after cancer. Now, it's that time of year again. It's flu season. And as a cancer survivor or a caregiver for someone with cancer or any other immunocompromised condition, you want to do whatever you need to do to minimize your chances of getting the flu. Because as a cancer patient, you are at high risk. So when you develop the flu, you are at very high risk of developing complications that are related to the flu. These complications include pneumonia, sinus infections, ear infections, and these things for someone with a compromised immune system can be deadly. So you definitely want to do what you need to do to minimize your chance of getting the flu. Now, what is the flu, you ask? The flu is a condition much like a cold, but it's much, much more serious than the common cold. You can have fevers, body aches, chills, shortness of breath, cough, runny, stuffy nose. If you have any of these symptoms as a cancer survivor, you need to contact your healthcare provider immediately. Let them know that you have flu-like symptoms. Now, I'm going to show you 5 ways to minimize your risk of getting the flu. First thing you want to do, you want to get a flu shot. The flu shot is the most important thing you can do to minimize your risk of getting the flu. You should get a flu shot this year, and you should get a flu shot every year. A flu shot will not give you the flu. Don't let anybody tell you that if you get a flu shot, you'll get the flu. It is not true. Second thing you want to do, don't be around sick people. If you have someone in your household, in your workspace who is sick, don't be around them. Minimize your risk of catching whatever they have, but don't be around them. No further explanation needed. Don't be around sick people. Sick people will get you sick. End of story. Third thing you want to do, you want to wash your hands constantly. Soap and water is best, but if you don't have soap and water available, hand sanitizer will do just fine. Fourth thing you want to do, you want to sanitize your workspace, your work area, the things that you touch constantly, your cell phone, your pens, your pencils, your keyboard on your computer. You want to definitely sanitize these areas. Don't worry about feeling like a germaphobe. You're trying to keep yourself from getting sick. The fifth thing you want to do, you want to avoid touching your eyes, nose, and mouth. When you touch your eyes, nose, and mouth, and you have the virus on your hands, that's how you transmit the virus into your body. Now, if for some reason you do all of those things and you still develop symptoms of the flu, first, again, contact your healthcare provider immediately. Let them know that you're sick. Number 2, you definitely want to get an over-the-counter antiviral medication. You want to start that as soon as your symptoms develop because they work best if you start them within 2 days. But again, definitely contact your healthcare provider. They will give you further instructions. If you are a normal risk individual, you've been cancer-free for a number of years, you're not under active treatment. If you develop symptoms of shortness of breath, very high fever, chest pain or pressure, nausea, vomiting, confusion, you want to go to the emergency room immediately and be evaluated. Again, flu season lasts from October to May. So long after people stop talking about it, it's still flu season. You're still at risk for getting the flu. So definitely watch out for these signs. This is Dr. Tonya. I've given you 5 ways to minimize your risk of getting the flu. If you like what you heard, please like this video, follow my channel, subscribe, and tell a friend about us.